Hello friends, so today I am going to talk about compartment syndrome. So it is one of the very important topic in orthopedic as well as in general surgery. So what is compartment syndrome? It is that the definition is here: when the tissue pressure within a closed osteophyseal compartment exceeds the perfusion pressure resulting the muscle and nerve ischemia, it is known as compartment syndrome. So basically the pressure within the compartment, the osteophyseal compartment increases, and that leads in the decreased perfusion, and that eventually lead to the ischemia of muscle and nerve in that compartment. So the most common sites are volar compartment of forearm, anterior and deep posterior compartment of leg, and next are rare site. Other rare site are shoulder and foot, buttock, paraspinous muscle. So main important site are volar component of forearm, that is the flexor compartment, and the anterior and deep posterior compartment of leg. And in the causes are forearm bone fracture, fracture of the radius and ulna, the fracture of elbow, supracondylar fracture. This is very important. In the supracondylar fracture, there will be Volkmann ischemia, that is the compartment syndrome is known as Volkmann ischemia, and that eventually lead to Volkmann ischemic contracture and supracondylar fracture. And next is proximal 1/3 of the tibia and fibula, that is closed fracture of proximal 1/3 of tibia and fibula, cross injury to leg and forearm, traumatic swelling of the limb, and we have the snake bite that also cause compartment syndrome. Now the talking about etiopathogenesis, the compartment syndrome results due to various causes, like first of all, it might be due to decreased compartment size, as in the case of closure of facial defect, constrictive action of cast and dressing, localized external pressure, or there may be increase in compartment content, like due to fracture hematoma, bleeding disorder, edema, and internal fixation. There might be increase in the internal compartment content, and there may be increase in capillary permeability and the pressure, like in the case of bone trauma, post-exercise seizure, venous constriction. There may be muscle hypertrophy, infiltrated infusion, nephrotic syndrome. All these cases, the pressure within the compartment increases, and that leads to the various consequence, like first of all, due to venous occlusion, there will be intramuscular edema, increase in intramuscular pressure, venous lymph and lymphatic obstruction. There will be arterial occlusion or spasm, and finally muscle ischemia. This again muscle ischemia will release the histamine, and that increase capillary permeability. Again muscle ischemia. This result in vicious circle, and finally it result in the muscle ischemia due to trauma due to muscle ischemia. All this cycle repeats here again and again. Very dangerous situation. So talking about clinical feature, the clinical feature of compartment syndrome like include the pain, paresthesia. By it can be remembered by 6P, that is pain, paresthesia, pallor, paralysis, pulselessness. The pulselessness is very late sign. The passive stress test, like that is earlier sign. When we stress the limb passively, it result in pain, and the passive stress test is earlier sign. Pain occurred when the ischemic muscle is stressed, and the pulselessness is very late, and it's not so reliable sign. Other sign are paresthesia, pain, paralysis. And the diagnosis is by, again we have the excessive pressure that is not relieved by usual dose of analgesic. The passive stress test is positive, that ischemic muscle when stressed by that gives the pain. Tense compartment, hypoesthesia, and the distribution of inward nerve. The pulselessness, the pulse remain palpable till very late stage, so it is not so reliable sign. And the muscle weakness, there can be the measurement of intercompartment pressure is more than 30 mmHg. This indicate compartment syndrome. Intercompartment pressure is more than 30 mmHg. And also yet not mentioned, but delta pressure, that is difference between the diastolic pressure and intracompartment pressure should be less than 30. So delta pressure is less than 30, or absolute pressure, intracompartment pressure more than 30 indicates the compartment syndrome, and this is measured by the manometer. And if intracompartment pressure cannot be measured, then 3 or more sign of ischemia should be present. Then we can say that this is the compartment syndrome. And we have the prevention. How can we prevent the compartment syndrome? It is done before compartment syndrome ensues in susceptible cases. As we know, the various fracture of the fracture like supracondylar fracture and fracture of the tibia fibula, we know that we can suspect the compartment syndrome. So in that case we should be alert, and the limb elevation and active finger movement are helpful. The cast applied should not be very tight. The cast must not be applied for closed fracture if there is marked swelling of the limb. Slab is preferred for limb stabilization, and cast is applied only after ruling out sign of ischemia. What is treatment? This is compartment syndrome is orthopedic emergency. The threatened compartment or compartment must be promptly decompressed. The cast, bandage, and dressing must be completely removed. Just merely splitting the pass is useless. That is not helpful. And the limb should be nursed flat. The elevating the limb causes a further decrease in capillary pressure and aggravates the muscle ischemia. So we can do the fasciotomy. We have just said the delta pressure difference should be less than 30. It is an indication for immediate compartment syndrome. We have to do the open fasciotomy, and the forearm, the single incision along the ulnar nerve is okay. And in leg, all the 4 compartments should be released through the lateral and medial incision. The debridement, debridement of necros should be done. Necros tissue should be done. And fibulectomy, the mid 1/3 of the fibula is excised in order to decompress the leg. So this was all our short form of the just understanding of the compartment syndrome. Thank you.